Okay, let's begin. So a very warm welcome to everybody. My name is Helen Turek. I'm working with the OGP Support Unit as a Senior Regional Coordinator for Europe. I will be your moderator today. We're delighted to see so many people from the open government community join this regional discussion, Open Response, Open Recovery in Europe, what's next? I can see that we've got people from civil society, government, regional institutions, other partners. This is a really great opportunity to discuss how the community from the region has been affected by the pandemic and how you've been using open government to respond to the challenges of coronavirus, as well as the impact of the pandemic response on civic space in your countries. Before we begin, I just want to go over a couple of ground rules. Please ensure your mic is muted whenever you are not talking. I invite you to turn on your cameras so we can all see each other. There's also the naming convention, which you can see on the slide. If you could do that, would be wonderful. And we encourage you to use the chat function throughout the webinar. So we're going to begin this discussion with some very exciting lightning talks. Firstly, we have Sanjay Pradhan, CEO of OGP, who's going to be talking about the importance of keeping open government principles at the center of the pandemic response. Then we have Bojana Selaković, Program Director at Civic Initiative Serbia, who will talk about how civil society in Serbia came together in the response to the pandemic. Then we have Vasyl Zadvornyy, CEO of ProZorro from Ukraine, who will talk about how open contracting is helping Ukraine tackle COVID-19. Finally, we'll hear from Niklas Kramer from the German Federal Ministry of Health, who has come to talk about the new contact tracing app from Germany. And during these lightning talks, please feel free to use the chat function to share your thoughts and ask questions. After the lightning talks, we're going to move into breakout groups for about 50 minutes of small group discussion. These breakouts are going to be facilitated by some members of the OGP Steering Committee and our other partners. Please note that you're going to be sent automatically to a breakout group and you will automatically be returned to the main session once those breakouts are finished. Please note that we're going to be recording the main session and the lightning talks, but the recording will stop when you get to the breakout groups and their Chatham House rules will apply. Right now, I want to run a quick quiz before handing over to Sanjay for the first lightning talk. You should see the quiz pop up in a moment. The first question is looking at suspension of right to information activities. And the second question is looking at publication of COVID testing data and looking at that in Europe in relation to other regions. So take your time and take that quiz. We'll be reviewing those answers before we head into the breakout groups. But let's dive right into the lightning talks now. So over to you, Sanjay.
Hello, can you hear me?
Yes.
Okay. A very warm hello to everyone. So let me share with you concrete ways in which open government is helping with COVID-19 response and recovery. To begin with, an open response can save lives in two ways. First, in countries where there has been relative early success in curbing contagion, albeit with some recent spikes, such as New Zealand, Germany, Slovakia, South Korea, and Taiwan, a key factor behind early success has been open, proactive, reliable disclosure of information by the government, which empowered citizens to take mitigating actions, saving lives. In contrast, in China, Iran, and the US, the initial delay in disclosure of threats jeopardized lives. Second, open government can help with effective procurement of life-saving medical supplies at speed while mitigating the risks of corruption, price gouging, and counterfeit supplies. You know, as New York desperately struggled to acquire ventilators, it paid a whopping $69 million through an opaque contract for 1,500 ventilators at triple the retail price. Tragically, none were even delivered. To mitigate these risks in Latvia, civil society pressured the government to publish information on emergency contracts, enabling public oversight. As governments move to the recovery phase with massive stimulus packages, such as the EU's 750 billion euro recovery instrument, Next Generation EU, transparency, citizen oversight, and engagement can build trust and help ensure that, that these programs achieve their intended goals. For governments, this has three cross-cutting implications for action. First, disclose budget in searchable, accessible, ideally open data formats to enable citizens to follow their money, as was done with the $800 billion US Recovery Act of 2009. Second, open contracts to public scrutiny to save money, fight corruption, and spur economic activity, as we will hear shortly from Ukraine's ProZorro experience. Third, make lobbying and company ownership transparent to ensure that COVID-19 stimulus and bailout funds are not captured by the politically connected, and to ensure that these do not accrue to companies registered in offshore tax havens, as Denmark, France, and Canada have ensured. As governments take these measures, citizens, civil society, businesses can engage to shape recovery, follow the money, and ensure that stimulus and safety net packages accrue to those who most need them. You know, in Italy, the government disclosed details of 1 million EU-financed projects on an online platform, but then coupled this with a massive information campaign to empower citizens, including high school students, to become on-the-ground citizen monitors of these projects. This same approach can be replicated for the Next Generation EU stimulus package and for the reinforced budget for transition to a green and digital Europe. For all this requires civil liberties, which have been under attack in several countries and must be restored in order to enable citizens to freely shape response and recovery efforts. For all this, the OGP platform will enable government and civil society to convene and advance concrete actions for open response and open recovery through the OGP action plan, as we are seeing in countries like Armenia, Nigeria, and South Africa. So in closing, I call on government and civil society in Europe to join forces for open response, open recovery, for transparency, citizen engagement, and oversight in stimulus and safety net packages, for ushering a longer-term shift that puts citizens at the heart of governance. Thank you very much.
Thank you very much, Sanjay. Some great examples showing how important it is to have open approaches to the response and recovery efforts. Now we're going to go to Bojana from Civic Initiatives, who has a great story from Serbia about how civil society came together during the pandemic to support the community. Over to you, Bojana.
Thank you very much, and thank you for this previous very inspired speech. Unfortunately, my speech will be some kind of back to the reality. And before I start to share civil society experience in my country, I would like to provide brief information about the context in Serbia. And actually, this is very interesting experience for me to speak at this panel with these topics, open response and open recovery, in the week in which the citizens of Serbia learned the results of the parliamentary and local elections, which were the first elections in Europe during the pandemic. And what is important, these elections had the least democratic features and the least legitimacy in a period of 2 decades. Due to the active boycott campaign of the opposition parties, less than 50% of citizens actually voted. And the composition of the parliament is such that the party that has been ruling since 2012 will now have an absolute majority in the parliament, with only 2 other parties that actually were their partners during the previous period. Actually, now, for the first time after 25 years, we will not have democratic or pro-EU oriented parliamentary groups in Serbia. This is also a week in which there was a drastic increase in the official number of infected in Serbia, and in the week in which the investigative portal discovered and published data on our harsh reality, which means that our government systematically lied about the numbers of deaths caused by COVID during the state of emergency. And that in the last few days, since all restrictive measures were suspended in Serbia due to election campaign and borders were open, all public gatherings and football match were allowed, official data were falsified. During the last 2 weeks, we have a constant number of infected, which was 90, but journalists have found that number is actually between 300 and 400, unfortunately. And also, this is a week in which the consultative process for the creation of 4th OGP action plan began in Serbia. And because of all these things, a week in which I have to say that I'm really ashamed because my government considers itself a member of the OGP initiative, taking into considerations what we heard in previous speech. All this that I talked about is actually consequence of the long-term systemic action, despite many warnings and alarms from civil society. The space for civic action in Serbia was narrowing even before the pandemic, actually in that kind of circumstances, we entered a pandemic and a state of emergency. The measures that Serbia initially took were among the most restrictive in Europe, with only one goal: to reduce the pressure on the already weak healthcare system. All other values are therefore forgotten: transparency, responsibility, access to justice, care for the most vulnerable groups. And I can very proudly say that in this sense, civil society organizations have taken on a significant role, both in the humanitarian response and defending these values through strong monitoring and fight to preserve them. In that regard, unfortunately, this was not for the first time to have this kind of emergency in Serbia. And guided by that experience, especially from the floods in 2014, civic initiatives have launched a mechanism for coordination of CSO's efforts, believing in their rapid reaction and the significance of united response. We sent a questionnaire to numerous civil society organizations about their crisis activities, the needs of their groups, and the services they will provide. And as I said, 2 main activity groups have been identified: humanitarian activities and strong monitoring of different aspects of the state of emergency. In that regard, I would like to shortly present 2 very interesting examples. One is related to the local organization named Rainbow, who actually was an organization for providing support to LGBT persons, but they expanded their scope and start to work with Roma, people with disabilities, any kind of other vulnerable persons in Serbia. They developing individual security plans for the prevention of COVID virus and also delivery food and other necessities during the period of state emergency. What is also important is that this organization was involved in the coordination efforts within their community and other local self-government activities. And this is one very good and very rare example in Serbia, where civil society organizations were involved from the beginning in coordination efforts together with their local authorities. Now, based on all this information collected during the state of emergency, they will advocate at national level, and they identified gaps and challenges within the legal system, and they will try to support the beneficiary in a long-term way. Of course, beside them, there were a lot of similar organizations with similar approach, but as I said, another type of activities is related to monitoring. UCOM organization is Association of Lawyers for Human Rights, and from the beginning they actually provided a legal assistance, free legal assistance for the citizens of Serbia, because there were a lot of problems and challenges in terms of implementation, different laws and regulations during the state of emergency. And they were available on a daily basis with different form of communication. And actually now they will institutionalize identified gaps and challenges within the accession to justice in Serbia. This was actually very good exercise for them. Now, as it is expected, all citizens need solidarity and mutual help from civil society organizations more than ever before. And now, after first crisis and humanitarian response, we need advocating for sustainable solutions. In that regard, we will continue to map further needs and possible interventions and activities within civil society. But what is very important, due to all data presented at the beginning, civil society in Serbia, and I believe in the entire region of Western Balkans, need very strong support from the OGP community, stronger than ever in defending and protecting values such as openness, transparency, anti-corruption efforts, access to justice, and also to provide stronger political pressure for recognize CSO's efforts and accept their contributions based on direct field activities with citizens. Of course, sharing more lessons and good practice examples is always useful. So I will stop here, and I'm available for any other further questions.
Thank you very much, Bojana. Thank you very much for these messages. I think what you're talking about is very important, and we can see from these examples the importance of the role of civil society at the moment. And we're going to be discussing in the smaller breakout groups some of the issues around civic space, so there's going to be opportunity to delve into some of these issues in more depth. So thank you very much. Thank you for your frank discussion. Just to apologize for the poll difficulties that didn't launch correctly, so that popped up a few times. We're going to do that at the very end after all the lightning talks, so it doesn't interfere with anybody else's talks. So apologies about that. And just to encourage people to keep using the chat function, please feel free to ask the presenters questions. They're still here and can answer your questions in the chat box, so please feel free to use that. Now we're going to move on to Vasyl from ProZorro. I'm sure many of you know ProZorro already and the great work they've been doing over the last years to clean up contracting in Ukraine. Vasyl, you're going to talk about how you've been dealing with the challenges of emergency procurement, I think. So over to you.
Yeah, great. Well, first of all, nice to be here and to share Ukrainian experience. I wouldn't go through all the steps we took through the start of the pandemic. I just want to describe probably the main outcomes and findings that we faced. You also can refer just my blog on the OCP site. And I would start with a example, with a story from our experience, because this pandemic introduces us not only the problem with the healthcare, which is quite obvious, but also introduces a lot of problems on the procurement side, and not only like in terms of Wild West procuring, as they called it, but also with the dealing with some of kind of corruption schemes. In Ukraine, in Kiev, in the capital city, Kiev city administration at the very beginning of the pandemic announced that they would like to procure special cameras, which will works as a face recognition system, and which would measure temperature of Kiev citizens, and which costs up to $2.5 million. It's quite a big amount of money in terms of Ukrainian case, and just spending this money for the equipment, which is not, I would say, commonly used all over the globe, was kind of suspicious. And just because of using of open data in procurement, regardless of like urgency procurement in Ukraine, and because of pressure which was made by the civil society, this procurement was stopped and money wasn't spent. That's probably the example which depicts how the parallel usage of open data and emergency procurement can be used within the extreme situation as it was within this pandemic. If we are talking about the procurement within the pandemic situation, so at the very beginning, that was a huge unfitting between the demand and supply, and probably the vast majority of procuring entities faced. Probably a lot of procuring entities faced this problem, and the lack of medicine equipment, and the lack of supply providers, and the lack of understanding basically which hospitals, which equipments requires, and how this demand should be fulfilled. Thousands of procuring entities have experienced this unpredictable level of demand and an understandable level of shipment. In this particular case, opening data about the both part, demand and supply, helped us to match this supply-demand request and decrease the pressure from the civil society. But talking about nowadays, we understand that right now we not only should continue to conduct an urgent procurement with still being transparent, but also we need to think about how to recover the procurement and the contracting part as well as it was done in the healthcare system. So definitely we should think about decreasing the level of urgent procurement, which is pretty high right now in Ukraine, and we should use this momentum in order to build centralized optimal procurement strategy for all other cases. There are several takeaways we can highlight today based on Ukrainian experience, and probably the three major of them is such. First of all, we should stay transparent even in the most urgent cases. It's pretty understandable that being transparent in these unsafe circumstances is somehow perceived to be harmful, but still I truly do believe that being transparent and showing your current real demand and current real supply can help to emerge and to create new opportunities for all market stakeholders. For example, in Ukraine, 1,000 suppliers shifted their production from their non-medicine equipment to a medicine equipment, as they saw a big demand from the healthcare system. Second of all, even being transparent within the urgent procurement, you should establish and understand the recovery plan, because all the urgent procurement tends to stay even after the pressure goes away, and that's the big problem we are dealing right now. And that's the moment where transparency also helps, because you can just calculate amount of money which are probably being spent not so efficient and not so in not so efficient way. And the third of all, this pandemic situation can be a momentum in order to introduce new, more efficient and more comprehensive procurement tools. For example, in Ukraine, this situation helps us to introduce and to start the central procuring body as the body which covers all the demand for all Ukraine. It helps us to improve the capacity of electronic catalogs, and it also helps us to improve the stock management system for their healthcare system. At the end of the day, as a resume of Ukrainian experience, I would say that this experience helped us to understand that being transparent and opening the data, regardless of being perceived as a kind of harmful and unsafe practice, really helps not only government to fulfill their demand, but also to civil society and to private sector to address the existing problem in a quick and efficient way. So probably, yeah, that's it from my side.
Thank you very much, Vasyl. Great to hear ProZorro still being an exemplary example of open procurement even during the pandemic, and how you've taken advantage of the situation to focus on improving efficiency. Fantastic, thank you so much. I apologize if you can hear a drill that's just started in the background here. It's fun of working from home. We're going to move on now to our final lightning talk. Niklas from the German Ministry of Health. He's going to be talking about the new app that was launched last week. There's been a lot of chatter about this on Twitter the last couple of days. Maybe you've seen this, but over to you, Niklas, to tell us more.
Yeah, hello, do you hear me?
Yes, we do.
Can you hear me? Okay, perfect. So, yeah, thank you for having me here, giving the last lightning talk at this Open Governing Partnership and telling you about our Corona Warning app as an example of an open response to the crisis. During the course of the pandemic, there are people and media were looking a bit envious, let's say, to examples seeing in South Korea and Singapore, having those so-called tracing apps for automatic contact tracing as a supplement to, let's say, that the manual contact tracing of the public health authorities to identify the respective people. And then for us as a Federal Ministry of Health, this was a certain challenge, let's say, in this regard, that I mean, we are strongly believing that digital health can play or plays an important role in fighting the pandemic, but let's say there was also a certain promise of technical salvation to it. So people thought, okay, if we have this app, then you know, we will be able to fight the pandemic, and then it was necessary also to stress that this is only a building block among other building blocks which can be digital, but also are non-digital, how to address the pandemic. And then also, I think there was a certain underestimation of what does it mean to develop such an app, because you have to do all the technical insurances, you know, you have to have the calibration in place. You know, you want to have a high number of people using this app, and then also you need a connection to the healthcare system, let's say, in the sense that you need a connection to the testing and the verification of the testing. So it wasn't, let's say, a simple task to do that. And also there was a strong willingness in Europe to say, okay, we want to not give up upon our data protection and data security standards along the way fighting the pandemic, but we want to preserve these standards. And then there was a scientific, rather consortia and development taking place, a so-called PEP-PT initiative, a pan-European privacy preserving proximity tracing initiative, and they set out the technical standards based on Bluetooth low energy and let's say, encrypted proximity data, so no location data being involved, whereas some countries use GPS, for instance, for giving or for complementing the contact tracing activities of the public health authorities. And then there was a broad public debate, and we followed that path. But then there was a certain criticism coming up. First of all, the argument was that in that one architectural concept, there was a central server involved where the matching of the keys would take place. And then there was criticism towards that, but also within, let's say, this consortia, there were certain questions of how transparent this way was. Also, the coding was not to be at least fully open source. And then this was end of April. We and our minister then had to react to this and decided, okay, we need to restart this project, going with an architecture which is fully decentralized, so that the matching of the keys would take place decentrally on the phones, and also, of course, as other governments, we were also depending to a certain extent. I mean, we were in constant dialogue also on Google and Apple with their API, since we needed to have integration with the system in order to avoid too much energy loading using Bluetooth. And yeah, so this was end of April. Then we set up a new development team with Telecom and SAP as two big, let's say, telecommunication companies and IT companies in Germany, and then also along the line the Scientific Institute, Fraunhofer, and Helmholtz Institute, which were already involved also in the development in this broad scientific community before, and then for the epidemiological requirements, the Robert Koch Institute, which is the German Federal Public Health Authority. And then, I mean, the last 2 months, there were a lot of intensive work, not a lot of sleep. Also, you know, it's a project involved a lot of steering along all these questions you have to take into account. But also it was very much open then. This was a major requirement to be open source from the very beginning, and the developing team, the certain developers, SAP developers, Telecom, they were talking constantly also with the communities. There were webinars, and it was yeah, fully open source, and you really could see the development of this app from the very beginning, and the different stages. And yeah, I think now with 13 million downloads, which is quite a number, I think this proves that this broad debate actually helped us. Also the criticism, also the broader debate, let's say, not only in the IT community, let's say, but also in the media and the newspapers, helped us really to get these downloads, to get this awareness of this app and how does it function. And yeah, and next step now is also to achieve a European interoperability approach, where we work together with other member states, and also the European Commission helps us here in a good way and puts a lot of efforts into this. But to conclude here, I think this is a good example, and this is something to be recommended, that actually this very broad and transparent approach helped us now having this app. We are now in a situation where we are opening up. We have easing our measures, but this app is a valid complement to the tracing. The more we are now opening up, the more we need to be ready to react to certain outbreaks locally or regionally, and we have to and this contact tracing app can be a good supplement, and also might help us in the future also as a technology. So yeah, that's where I want to finish, and thank you for having me here.
Thank you very much, Niklas. Great to hear from you. Seen in the chat box a lot of people being very supportive of the open source approach. Thank you all to all of our speakers. Sanjay, for framing this discussion. I think we've seen how an open government approach applies to many different areas, from civic space to emergency procurement to track and tracing apps. So I really appreciate these lightning talks.